What's up, everybody? This is GreyMan here with another Medical Monday. So on this episode, if you haven't noticed by the thumbnail or the title, we are going to be talking kind of a little bit, we're going to dive into it in regards to minor wounds and kind of progressing a little bit into some hemorrhagic kind of issues and things like that. But we're not going to go too far with it because this video will be 2 hours long. But let's get the pleasantries out the way. And what I mean by that is in each video I like to state, especially on Medical Mondays, that I am not a medical professional. Yes, I have a history in the military and so on and so forth, but please, this is for informational purposes only, and hopefully to guide you in the direction where you can follow and do some more research and speak to medical professionals that you might have questions with, be it your doctor or nurse or so on and so forth. That being said, let's go ahead and dive into it. So anyways, first let's kind of go into, a lot of people don't think that the, minor stuff is not that big of a deal, but it carries the risk of infection, which leads into more, problematic issues down the road. And, and that's what I want you to take away from like the small stuff, because small stuff can evolve into big stuff, and it can be extreme situations where it can get out of hand. Alright, so I got my notes up as always, and let's go ahead and dive into some of these topics. First, let's go ahead and just dive into something simple. Cuts and scratches, man. And that's what I mean by minor wounds is, it's a soft tissue injury that kind of it's when it fails to penetrate deep layers of the skin. I wish I could just kind of show you, but it's like a scratch, a bruise, or something like that. It's very simple, and that would include all your cuts, scrapes, and bruises, and so on and so forth. So let's dive into each little one, and then we'll kind of talk about it a little bit, if that makes sense. So let's go into cuts and scratches. These are tears in the skin that only penetrate the epidermis, your skin, your top layer, superficial. And what I mean by that, it can be infected, and yeah, man, I'm tripping on my words already and haven't even started. Anyways, it can become infected and create issues. Let's say you're out in the woods and you just happen to get cut or an abrasion or something like that on there, and you think nothing of it, and then you continue on. And I watched this last night, and this is the reason why I want to kind of tear apart The Walking Dead, because Maggie got this nasty cut from a rusty metal thing. She kind of poured water on it and wrapped a bandana around it and called it a day, which I think she probably made a mistake, because throughout the episode they did nothing with it and they just continued on. Anyways, let me stop going that direction. Let's talk about, let's say, an abrasion. This is where a portion of the epidermis has been scraped off. You probably have experienced plenty of these as a child when you scuff your knee, you're on a bike, your big wheel, if that brings back memories for some of you folks. But you get the gist of it. It's just a little owie, a little boo-boo, as I like to call it. We run into a lot of these as children, and most parents are smart, especially this day and age. They will go ahead and clean the wound with some hydrogen peroxide or something like that. Get a Band-Aid out, and then, put some triple antibiotic ointment on there, put the Band-Aid on, and call it a day. And then what some people fail to do is to follow up with those things, not to say they always will go this direction, but they can get infected because, be it children or being what you do for a living or what you're around. But it's good to, each day, check on that wound, clean it, and reapply the dressings and the triple antibiotic. It'll help speed up that process of healing. Last quick one that we want to go into with the minor wounds is basically bruises and contusions. These result from blunt trauma that do not penetrate the skin at all. However, the bleeding into the skin from blood vessels that have been disrupted by the impact. So a lot of you guys, hopefully not a lot of you guys, you've been punched in your eye, or you fall down and you hit something. Let's say you're walking in the kitchen, and you just happen to catch that corner of that table, and it hits you good, and and it leaves a nasty bruise. And everybody's probably familiar with the bruise. There's different ways to handle bruising, but some people do the cold meat thing. You can take a piece of frozen meat and you put it on that bruise, and so on and so forth. But bruises, I don't want to go into detail. You know, yes, they can be problematic, but most of the time they're not so much. But most of these minor injuries, you know, they can be handled relatively easy. And a lot of you guys are probably familiar with this. But this is just kind of following up where I'm leading into this. So, like I said before, you want to wash your wounds thoroughly. You know, and like I said, use some sort of antiseptic. You know, you can use, you know, like I said, triple antibiotic, Neosporin, Bactrin. Basically, they help prevent the infection, if that makes any sense. But I think I've discussed some of that, so you guys should be aware of a lot of those medications. And minor bleeding can be stopped with a lot of different things, you know, and this is like minor bleeding. We don't mean hemorrhagic or, you know, full-on bleeding. But what I wanted to, you know, discuss is a lot of people, you know, people who shave, you know, they have what they call, what's the name of it? And I'm going to probably find a picture of it. A stiptic pencil. Anyways, it's normally used for shaving cuts. You know what I mean? It's a little thing that it looks like a little white pencil. And I'm gonna put a picture up, and that'll make more sense to it. But you know, it helps with the skin is broken. You know, for like really minor irritations and cuts and little bleeds and nicks and stuff like that. But it works great for stuff like that. What else can we think of? I don't know if you guys ever heard of like New Skin. It's like a liquid bandage, which is kind of cool because of the way it works. So you know, I think that's kind of nice to have as well as an adhesive, or not an adhesive, but as a bandage itself. It's just an excellent way to cover, you know, minor injuries, if that makes any sense. You know, just like Band-Aids and stuff like that. But New Skin is actually really awesome. It kind of puts like a layer, and it kind of looks like, you know, it's like mimicking skin as it heals, if that makes any sense. Yeah. But anyways, you know, and just to touch on bruises, so to make sure that I did cover it, you know, you want to apply pressure, ice, you know, especially if it, you know, the bruise seems to be spreading, you know, or getting bigger. You know, bruises will change in color over time and kind of give you know, like that brown to yellowish color or that hue when they're healing. So that's enough about bruising, and we'll move on. Anyways, so let's kind of touch on, you know, when you get a cut or something like that nature, you kind of want to evaluate the seriousness of the wound if it's minor, and you can continue with, you know, the minor stuff and then use like home remedies as well, because I like home remedies because in a shift event, those things might come into play. You know, like I said, I've always said, dig into, you know, a lot of, you know, books like this, you know, and the reason is because you might not have access to traditional medicines. So knowing these medicines and you know, that could be like, you know, that one's called backyard medicines, but you know, the natural remedies and how they can help and what you should kind of like stock up on or prepare with, or even grow. But you know, so let's say after the minor bleeding has stopped and you're looking to you know, either clean the wound, you know, you've used and speaking of minor bleeding, you can use certain stuff like, you know, herbal blood clotting agents, you know, other than, you know, you know, and I'm going to go into quick clot and a bunch of other stuff like that here in a second, but I just read it yesterday, but you can use like yarrow, cinnamon, cayenne pepper powder, you know, stuff like that. You can compress it with gauze, which, you know, hopefully you guys have like gauze, you know, just laying around, or not laying around, but, you know, in your med bag. And then after, like I said, after that, you can use stuff like lavender oil, tea tree, rosemary, eucalyptus, peppermint, raw garlic, unprocessed honey, witch hazel, St. John's wort, just to name a few. So those are some great things that you can use for you know, as a blood clotting agent and also as an antiseptic, so on and so forth. But so anyways, that you kind of want to dress the wound after that. You know, you want to use gauze, and the thing is with some of these wounds, you don't want to go too tightly. If it's not just bleeding out and stuff like that, if it's just like a minor thing, like I said, you want to just not wrap it too tightly, and you want to make sure that you use clean gauze. Yeah, I know some people, man, I've seen some weird stuff out there. And like I said, again, change the dressing, reapply the antiseptics, observe for, infection. Some people do it daily. It's recommended that you do it twice daily until it's healed. But so that's just kind of a brief overview in regards to, minor wound care, scratches, bumps, bruises, and stuff like that. Now, that being said, sometimes you guys are going to run into, bad situations, hemorrhagic and major wounds. And this is where things get more scarier and more of an emergency situation. And if you're not in a shift event, you know to call 911 as soon as something like that happens, but having stuff in the home to kind of prep that situation can actually be beneficial. Let's say, like I said, it only takes a few minutes to bleed out, so let's say if you have something, some tourniquets laying around, you know what I mean? And knowing how to use them and how to apply them will be a lifesaver, you know what I mean? Because let's say the ambulance takes 7 or 8 minutes. This could possibly save a life, having that and knowing how to use that product, if you know what I mean. So, all right, so let's kind of dive into this, I'm trying to think of where I should, jump into, basically, when you have a laceration or a puncture wound or something like that penetrates both the dermis and the epidermis, let's say like you get stabbed, you get shot, you get impaled, there's anything where it punctures those two layers and the blood starts to flow freely. Now that also depends on where, you get punctured or where you get lacerated at or where, these wounds happen, because that plays a part of it. Because you have your large blood vessels, God, can't speak. I never can speak. I trip over my words all the time, man. I wonder how people even pay attention to me sometimes. But, once you start reaching like the large blood vessels and tendons and nerves and stuff like that, things can be more complicated. You want to access the circulation, the sensation, ability to move the injured area, depending on where it's at. Stuff like nerve damage and can occur with like deep lacerations and let's say crushing injuries, like if you get your leg compressed, if you get ran over by a tire, a car or something like that. I don't mean like physically, but you know what I mean. I'm just trying to think of everything in my head because I have so much stuff that bombards me when I'm thinking. My mind starts moving rapidly. And that's why I put these notes here so I can kind of stay on topic, because if not, I'll just ramble on for hours and hours. But we'll talk about an extremity injury. You want to evaluate the capillary refill time to test for circulation beyond the area of the wound. To do this, you want to press the nail on the bed of your finger, or the toe. I'm sorry, I'm just looking at my notes. With a person with normal circulation, the color will return to white. When you release the pressure and then return to normal color within 2 seconds. If it takes longer or the fingertips are blue, there may be damaged blood vessels. If sensation is decreased, test by lightly pricking the finger. Today's not my day, guys. Today's not my day, guys. And you can use something like a safety pin or something like that, beyond where the wound is. You don't want it, if it's the finger itself, and you don't want to just stick a safety pin in there, just to kind of evaluate if there's nerve damage or stuff like that. Anyways, then we want to evaluate the blood loss, and evaluating the blood loss is a important aspect of dealing with wounds, specifically with an average sized human adult. They have about 10 pints of blood, so kind of want to think in that realm of things. You, as an average-sized adult, have 10 pints of blood. Now, this varies for children and so on and so forth. Again, like I said, do your research. Let's say one and a half pints of blood. Most people will not even won't have any effects. You can donate a pint of blood with no issues, and you can do this as roughly as every 8 weeks. Your blood rebuilds itself and repopulates. Anywhere, once you start getting beyond past that, you'll notice certain things. Let's say 1.5 to 3.5 pints of blood. You can, you have a rapid heartbeat, respiration occurs, The skin becomes cool and may appear pale. The patient is usually very agitated. If you're not accustomed to the sight of blood, you might be too. I wanted to throw that in my notes because some people see the sight of blood and they freak out, and you got to remain calm. You definitely have to remain calm when it comes to certain situations, especially when it comes to the medical aspect of things. I've seen people that as soon as they see that just a little bit of blood, they lose it. So you need to kind of familiarize yourself with that. Hopefully, if you have children and they get nicks and bumps, or watch some surgical videos. You'll be surprised, how some people can't even stomach to see that. But it's better to try to familiarize yourself with and kind of like lessen that emotion that you may exert when it comes to stuff like that. Because like I said, even small amounts, I've seen people with just a little bit of blood on the floor and they're freaking out, and so on and so forth. Anyways, let me stop rambling. Let's have some drink of water. I always appreciate you guys too, man, for dealing with my me getting tongue-tied and going off random tangents while I'm talking about certain stuff. But I'm glad you guys are here, man, and I appreciate it. All right, moving on. So 3.5 to 4 pints of blood. This is when things start getting more critical because your blood pressure begins to drop. The person may seem confused, lost. The heartbeat is usually extremely rapidly, or beating rapidly. So things are becoming critical at this point. And then once you get past the 4 points, the person you're looking at, let's say patient per se, they're going to be looking very pale. And even at that point, they might even be unconscious, to be honest with you. After a continued point, where the blood loss continues, you're going to lose blood pressure. You're going to have all kinds of things. Your heart rate is going to it's going to decrease rapidly. And that's when the person's going to come in serious danger. And, as a medic, when you're dealing with blood, make sure that you're protecting yourself. You know what I mean? Having proper PPE. Specifically like, nitrile gloves, whatever you can to protect yourself. I'm not going to say go grab a face shield and gowns and stuff like that because, it might be happening right on the spot. You might come up on a car accident or something bad and you might not have all this stuff. But always carry some gloves with you, man, because you want to protect not only the patient but yourself when it comes to rendering aid. Even if it's your like, let's say, a significant other or a family member or stuff like that. You just never know. It's better to be precautionary versus not to be. But yeah. Now, sorry, I'm just kind of glancing at my notes to make sure I'm on the right path here. But anyways, when it comes to hemorrhaging, it's all about direct pressure to the wound. And that's why I say wear gloves, because some blood will be going all over the place. And and sometimes applying direct pressure to a wound can actually help. It actually may even stop the bleed, depending on where the bleed is at. You know what I mean? It can even stop the bleed. But then you want to get into stuff like compression bandages and stuff like that before you want to try to do a few options before applying the tourniquet. This is like and I'll talk about this in a second. And this also helps with knowing certain pressure points in the body, and that's why I always tell people to get books, where I have one here, all kinds of different books. I'm always reading books. Whoops, a microphone, all different kinds of books, and I'm looking that way to make sure I'm on camera and I'm in focus here. But all kinds of different books, because they'll teach you some of this stuff. I got books all over my desk. And the reason I say using pressure points is you can map specific areas to decrease bleeding if you know where to look for and where those pressure points are at. Being that there's a large blood vessel behind the popliteal artery behind each knee. If you can reach behind the knee, and you can actually, if you put your fingers there, you can kind of feel it. And yes, I'm doing it to myself right now, but you can feel the pump, the blood moving through there. And if you have a bleeding wound in the lower leg, apply pressure on the back of the knee. And like I said, because you got to look at the major arteries, and you know the difference between major arteries. You got veins. You can look at arterial. Arterial is going to be very very bright red. and let's say something with a vein is going to be darker in color, more of that richer dark red versus a really bright red. So that's how you can kind of distinguish between different types of bleeds, if that makes any sense. And I know there's probably people that can explain this a lot better than I am, so check those folks out as well. I'm just kind of going over some of the things that are popping in my head as I'm speaking to you about this. And I got a diagram up here on my screen. I wonder maybe I could, I don't know. Anyways, but you want to look at feet, wounds below the knee, wounds above the knee, thigh wounds, arm wounds, hand wounds, neck wounds, scalp wounds, and stuff like that, and kind of learn where those pressure points are. It'll help you. Trust me, it'll help you down the road. If you ever take like a class or something like that, they'll actually even show you to you. And that's I always suggest to everybody, take a stop the bleed class. Take some emergency preparedness classes and medical classes, CPR, things like that. It'll just help you a lot. And make sure you keep your certifications up to date. So let's say that the pressure bandage doesn't work. You're using your pressure points. You're using all kinds of different stuff, and it's not working. And so that's when you want to use your tourniquets. And knowing where to apply the tourniquet, is also going to be a key. So learning where to apply the tourniquet, how to use the tourniquet, those are going to be some important factors. And I'll probably do a video down the road. I just know it's been done, hundreds of times. So I'm assuming you guys have seen it done hundreds of times, using a tourniquet. But if you guys want me to show you guys specifically on my channel, I can show you, and just put it down in the comments that you'd like to see something like that moving forward. I have a few videos lined up for Medical Mondays coming up, things that people have been asking me about my full med bag versus my IFAC and stuff like that. And I kind of want to dive into that a little bit and kind of show you guys from a medic standpoint what I carry in a full med pack versus an IFAC or let's say a first aid kit. All right. So where am I at? Yeah, and the placement of a tourniquet to a wound, it must be you want to know exactly where to put it, because it's going to stop the circulation of the blood moving forward, coming from there, and stop the bleed, basically, if I said that correctly. And tourniquets are painful, believe it or not. Tourniquets be painful, but if they're placed there for too long, prolonged use could actually cause the patient to lose a limb. There's so many things, and that's why if you look on the tourniquets, they have the time, because there's a limited amount of time. Tourniquets it's not something you just put on and just leave on there forever. You know what I mean? It's just a way to stop the bleed from occurring and getting medical help. I.e. calling 911 or dealing with a medical professional. And I know you're saying, well, what about in a shift event? What about if I don't have access to a doctor or something like that? Yeah, and that's where we run into a conundrum. That's when issues arise. And having a thing like a MAG, which is a mutual assistant group, I like to say that because some folks aren't familiar with that term, but having a MAG can be very beneficial, and having medical professionals in that MAG, it's just a great asset, or knowing somebody that has that medical training. And even those situations, man, it'll be rough, and hopefully we never have to deal with stuff like that. Hopefully it'll never come to that. But like I said, there's a time limit on tourniquets, and there's speculation on how long it should be. Most people say maximum 24 hours. Some people say 7 hours. I'm not going to get into the specifics because it's always debated, but you guys can research it and look it up and make your own opinion on it. Or even just next time you're in the emergency room, if you're getting treatment for a cough or cold or congestion, or you go to see your doctor for your annual physical exam, say, hey man, how long should a tourniquet be applied if I ever had to use one? And get their opinion and see what they have to say. And then I always say get multiple opinions to make you better, or make you more well informed. Hopefully that that'll answer some of your questions. And also, when it comes to tourniquets, as it's blocking the blood, your blood can build up toxins, and then once you release the tourniquet, those toxins can rush into your bloodstream and then create more issues down the road. So anyways, I don't want to keep on digging into tourniquets because, like I said, I would go down a different tangent. I'm trying to think of where I wanted to go from here. I want to briefly touch on, knife and gunshot wounds and stuff like that. People have talked about chest wall seals. and depending on where where this happens, chest wall seals are made for your chest, to seal that. And I think people have I watched something else the other day that someone said that because it'll collapse your lung and so on and so forth, and you want to stop that air from getting out. You know what I mean? It's kind of like, I'm trying to think of a way to properly explain it. But your lungs, you breathe in, you breathe out. When you breathe in, you breathe out. Once that's punctured, it's sucking air in there, and all kinds of bad stuff happen. In layman's terms, if that makes any sense. But you've always heard the term, that the old wives' not the old wives' tale, but the saying that you should never remove a knife because it can cause hemorrhaging to worsen. And I know I'm jumping from bullets to knives, but I'm just saying, I'm trying to be brief. We're probably already 25 minutes in, and now I've lost my train of thought. But yeah, like I said, you've probably heard that you should never, remove a knife because it can cause the hemorrhage to worsen. This will give you time to get the patient to the hospital. But what if the question is what? This is what I go back to. What about if there are no hospitals? You have to transport the victim to your base camp. You have to prepare to remove the knife. You have to have plenty of gauze and clotting agents and stuff like that. So let's kind of, dive into clotting agents here in a second. And remember, everything that I'm saying is meant for survival situations. You know what I mean? It's basic information to kind of get you, hopefully, your juices flowing and your mind going into thinking, I need to do some more research. I need to learn some more of this stuff. Because in normal situations, you're going to call 911, you're going to go to the hospital, and things are going to be taken care of that way. So kind of what I mean about these Medical Mondays, they're more based for survival situations where help is not coming. So hopefully I can get that point across. Survival situations when help is not going to arrive, when help is unavailable, be it 911, doctors, nurses, and things like that you would go to in bad situations. So, a lot of people, they have different types of blood clotting agents. Excuse me. And one of the real popular ones is Quick Clot. Now you have the Quick Clot, the powder stuff that you can use. You have the Quick Clot bandages. And another one I want to touch on is called Celox. And Celox is a lot better than Quick Clot, at least from my opinion. Basically, kind of to break this down real quick, in battlefield situations, there's been research done with quick clotting agents and stuff like that. 50% of those who killed in action died of blood loss, 25% died within the first golden hour after being wounded. A victim's chance survival diminishes significantly after 1 hour without care, with a threefold increase in mortality every 30 minutes without care thereafter. Yes, I took a quote because I think it's very specific and valid, and I didn't want to mess that up. The control of major hemorrhaging, depending on, it's more of the territory of a trauma surgeon, and, again, what if you find yourself without modern medical care? So, like I said, there's various hemostatic agents that you can use, like I said, for medical storage, to prep. Like I said, the two most popular are Quick Clot, and a lot of you guys who have not heard of Celox, I'm going to put that on the screen so you know what I'm looking for. I think it's very beneficial to you. So, Quick Clot it's kind of funny story with Quick Clot. Used to have a volcanic mineral called zeolite, which effectively clotted bleeding wounds, but also caused reaction that caused some serious burns. Sorry, I have notes all over the place. The current generation is made from kaolin. It's a clay mineral. It's an original ingredient. If you ever heard of it, kaopectate, and you'll see why I'm laughing if you ever Google kaopectate. But it doesn't contain any animal, human, or botanical compounds. And like I said, back in the day with Quick Clot, it's the problem with it. The powder stuff, it doesn't absorb into the body, so it can be difficult to and it can be difficult to remove from the wound, which creates issues down the road. But Quick Clot has now stated that it's not an issue anymore, and they've got it all worked out. But here's where I'm going with this. so I stopped rambling, is the quick clot bandages are a better option. And like I said, personally, I think Celox is even a better option than the quick clot bandages. It's composed of chitosan. If you're not familiar with that, it's an organic material processed from shrimp shells. People even eat it as a supplement. Very interesting, but I'm not going to go in that direction. But basically, when Celox comes into contact with blood, it bonds with it to form a clot that appears like a gel. Like quick clot, it also comes in impregnated gauze dressings, and like I said, some dressings, and that's what I'm saying. The dressings I feel are better than the powders, even though the powders are very convenient. But the dressings I think are better because they're easier to remove, and you can put pressure on that, and it just has a lot of beneficials to it. They've been tested by the United States, they've been tested by the United Kingdom, and both militaries. They've been put to good use in Iraq and Afghanistan. And if you can ask any vet that's been deployed, or if ever, that's a medic out there that's been in Afghanistan or Iraq, they're probably very, very familiar with Celox, gauze dressings and whatnot. All right. So let me see. It says, so I'm looking at my notes here, and it says, although effective, these items should not be used as a first line of treatment in a bleeding patient. Pressure, elevation of a bleeding extremity above the heart, gauze packing, and tourniquets should be your strategy here. If these measures fail, however, then you have an effective extra weapon to stop the hemorrhage. See? I have good notes. When I read my notes, things go a lot smoother. But anyways, you guys get the gist of it. This is just a kind of brief overview of minor wounds and some hemorrhagic wounds and some things that you can do to maintain and take care of the situations. We can go deeper into it down the road, with soft tissue wound care and stuff like that. If I'm not running you crazy with my tongue-tiedness and sometimes my random interjections in what I'm saying. But hopefully the takeaway from this is you'll get some decent information in regards to what you can use, what you can prep, and how to use some of the material down the road by researching what I'm discussing. And that's why I'm trying to bring light of stuff like, tourniquets, stuff like, pressure bandages or compression bandages, brands like Quick Clot and Celox. Some people say Celox, whatever you prefer. Celox, Celox, however you want to pronounce it. We all say it differently, and depending on what part of the country you are. But I just want to get people, I guess, put in the right direction where they can start looking, okay, hey, well, I saw GreyMan's video. He discussed a few things. Maybe I should research it. Maybe I should look into it. Specifically, also, the medicinal aspects of, like, herbal remedies and some of the nature stuff, because that's going to apply become more and more important in a survival situation long term if things don't get back to normal quick enough. And learning these stuffs in even small situations, let's say like hurricanes, tornadoes, and natural disasters and emergencies, having not access to certain medical providers because of certain things are going on, like when hurricanes are at their full force, there's no one coming to save you. If you're in your house and your roof caves in and you get your leg sliced or something like that, or you get injured really bad, the winds are too strong, the streets are usually flooded, it's too much of a danger to the medical professionals, and they are not going to come until the storm recedes. So this is why I find some of this stuff very, very important, and hopefully you guys are watching to the end of this video and getting this information. But if you have any questions of what I say, and I am not saying I know everything, and I may be wrong about certain things, and that's why I say take everything with a grain of salt, but hopefully what I'm doing is getting you in the right direction. So that being said, I'm going to go ahead and wrap this up. I've spoke long enough, as usual, but look forward to, I have things coming up on Tuesday. Tomorrow I have something, a guest. I will announce that. I will put the thumbnail up this evening once we've 100% confirmed that it is locked into place. I always like to make sure before I announce things because you just never know. Anyways, guys, thank you so much for being here on Medical Monday with GreyMan, which is me. You guys have a great day, and God bless. I'll see you guys on the rebound. Take care.